All right. Hello, everyone. As Julie said, I'm Veronica Smith. I am the NCTOPPS super user here at Partners. And today I'm going to talk to you all about NCTOPPS and give you a slight introduction, as well as give you an introduction to what a super user is and some of the benefits of becoming a super user for your agency. So, what is NCTOPPS? If you're new to NCTOPPS and in this wonderful world, just to give you an introduction to it, it's a web-based system that is used to gather outcome and performance data on behalf of our consumers with mental health and substance use disorder diagnoses. And so it was launched in 1997 as a partnership between the federal government and the state. It started off as a paper-based system, and then it only had substance use disorder only as the diagnosis. So they started scanning to replace the web-based system back in 2005. And then consumers with mental illness were added in 2006. And then Outcomes at a Glance, which is one of the online dashboards that I'll mention later on in our training, was added in 2009. And then in 2011, it was redesigned into a web-based system that you see today, more user-friendly and functional. In 2012, they added the addition of service level data and created more ways to make it more functional and user-friendly for you all. And 2014, they added the simple query report, which I'll speak about later on as well. And then they added the advanced query report in 2020. So this is just to give you a little timeline of NCTOPPS and how it came about. So the big question is always, who needs an NCTOPPS? So those that need an NCTOPPS are adults and children ages 6 years and above that have been formally admitted into an LME MCO. And they must be receiving or participating in mental health or substance use services. And they must have a publicly funded source, such as state funds, Medicaid, etc., in order to need an NCTOPPS. So how does NCTOPPS work? So pretty much it's based on the submission of interviews. And so the main basis for the NCTOPPS is for those interviews to be done face-to-face with the consumer and the QP. And the objective is to enhance the clinical assessment process by providing information for the consumer's treatment plan. So this is done through an initial interview, and then there's a series of update interviews, and then an episode completion interview. And these are designed to help and assist in helping assist to make the treatment more effective. So the initial interview is designed to gather information on consumer demographics and pre-treatment behaviors. This is required to be done face-to-face within the first or second treatment visit. The updates interview is conducted on a 3-month, 6-month, a 12-month, and a biannual after the 12-month to gather information on the consumer status, changes, and any treatment outcomes. So when starting to use NCTOPPS, you'll go to the NCTOPPS main website, which you'll see the link here. Then you'll click on the link, and then you'll click on the link, and it'll take you to a page where you'll see several options of links that you can click on. And so when you're wanting to go to the NCTOPPS website, you'll click on NCTOPPS 2.1 website. And then you'll click on create new NCTOPPS user profile if you have not already had a profile created. And then you'll follow those promptings on the screen. And one of those would be to enter your name and a unique email address. And then you'll continue through the screens following. After your request is completed, the system will prompt you to create a secure NCTOPPS account. To ensure security of your account, you would definitely want to create a password and security questions that are unique to you. Your username will be assigned to you, and your new user request will be emailed to your provider agency superuser and your LME MCO superuser. So if you submit a request, it goes, if you don't have a superuser at your agency, it'll come to me, your partners, and then I would be the one to approve or deny that request. So I mentioned super users. So what is a super user? And so super users are individuals who have oversight responsibilities of their LME MCO, which would be me, or your provider agency. And every agency is required to have a super user. And so super users are able to track NCTOPPS submissions and due dates for their provider agency or LME MCO, change your consumer's QP, and manage user enrollment requests. So when submitting an NCTOPPS interview, you will need a CNDS number. For Medicaid recipients, the CNDS number will be the same as their Medicaid ID. For individuals not enrolled in Medicaid, partners will need to provide the CNDS number for that individual, so that they may be able to submit an NCTOPPS for the consumer. So also for anyone that doesn't have a Medicaid ID, or if you need that information for your consumer, we do have a contact here at Partners. Her name is Melina Wilmoth. And so pretty much you would email her and include the individual's name, social security number, and date of birth. So the best way to get ready for their interviews are to get familiar with the system, get familiar with NCTOPPS, get familiar with submitting an interview, understanding what questions are in the interview. And the best way to do that is by going into NCTOPPS and actually utilizing it. And so NCTOPPS has created a username and password for those that just want to practice. So if you wanted to just go in and practice without actually going into your actual profile for your agency, you can use the username training and the password training, and you can go in and practice by submitting interviews and allowing yourself to get familiar with it. So being prepared and doing that preparation prior to engaging with the consumer is very important, so that even if the consumer has questions about some of the questions that are being asked from the interview, you're already familiar with it, and you can give them examples and help them to better understand some of the questions that may be asked. So all the items in the interview are required to be answered before you can submit the interview. There are certain items on the update and episode completion interview which are important in determining consumer outcomes that are required to be asked directly to the consumer, either in person or by telephone, within 2 weeks of the NCTOPPS interview. So for the updates, they are time sensitive. They need to they would need to be the consumer would need to be there or either in person or over the telephone, because Otherwise, there are questions that I think after about midway through, if the consumer is not there, they will need to, the QP would have to stop answering questions in interview because it requires the consumer to be there to answer those questions. And the most important thing about and why NCTOPPS is such a big deal is because this is one tool that we have that we can utilize to receive the consumer's voice. And so that's why it's been stressed so much that that the consumer's there, whether it's in person or over the telephone. And then of course we have video options and video chats such as Zoom and Teams and things like that now that can allow the consumer to be a face-to-face interview and fall into those categories. But the other big thing is for the update and the episode completion is that there is a 2-week window between the due date and when you can submit the interview. So those are always good things to look at prior and when you're prepping for an interview is to see, that time period and make sure that you're in that time period so that you know that it'll be completed on time. All right, to submit an NCTOPPS, you'll go to the NCTOPPS main website. This is the same link that I went over before. And then you'll click on NCTOPPS 2.1 website. And then you can probably just save that website because this will be one that you'll definitely use very often with NCTOPPS so that you won't have to go through the main website. You'll log in with your username and password. You'll go to the locations tab, and then you'll select the appropriate LME MCO and provider agency location. So here's a screenshot of that. As you can see, the locations tab is here at the top. And then as soon as you hover over the locations tab, you'll see that the LME MCOs that you're associated with will appear. And then you'll go to your agency location associated with that particular LME MCO that you're submitting the interview for. So once a location has been selected, the website submission tab will appear and you will select Start Initial Interview. Or if you're doing an update on episode completion, or sometimes there's a need for a recovery follow-up interview, you'll click on Manage Episodes of Care instead of Start Initial Interview. So here's a screenshot of that so that you can kind of get an idea of what that looks like. So as you can see, that website submission tab appeared, and then the Start Initial Interview and Manage Episodes of Care options appeared under website submission, so that you can utilize those to either make an initial interview or to submit an update interview. So there are a lot of features that are available for QPs within NCTOPPS. There's the interview search feature, which allows you to search for any interviews that have been submitted using any consumer information, gender, interview status, date started and submitted range, consumer group, interview type, and location. And this report can be printed or exported into an Excel document. Okay, and so right next to the website submission tab, you'll see that the reports tab is right next to it. And it allows you to have that option for interview search or updates needed. So interview search, here's what that looks like. When you click on interview search, it provides you all of these different spaces here on the left side to add in the consumer criteria that you would like to search by. And then once you have all that criteria in the spaces, you'll click find interviews, and then of course they will populate here on the right. And with this, you have the option of being able to print that interview as well. So I kind of gave you a sneak peek at the updates needed report and where you can find that, but that's another feature that you can utilize in tracking the date that the updates are due for your consumer. And that allows you also to plan for making sure that, you know, those interviews are done in person, and that they're done also on time. Because as an agency and LME/MCO, NCTOPPS tracks the updates needed timely submission compliance. And so I'm happy to say that we have, as an agent, as partner, as a net partners, as a network, we have finally reached back over the 90% standard for 3-month update timely submission compliance. So I'm really excited, and kudos to everyone that has been a part of that, and making sure that those updates are submitted on time. So that part is super important, and just making sure that those updates are and episode completions are completed on time, so that we will all remain in compliance with that particular standard that's required by the state. The individual report and displays select NCTOPPS items from the initial interview and the 2 most recent updates. If completed for a consumer, this report can be shared with them during their person-centered planning if you desire. So as you can see below the interview search, the updates needed report is located right below that under reports. And this one can also be exported as well or printed. Data entry users. So each agency can have QPs or a data entry user. And these are the 2, this is an additional resource for the QPs that can enter the interview data on the QP's behalf. And so this would be more so utilized if you're wanting to print out the interviews, and the QP utilizes the printed copy versus submitting it online right then and there with the consumer. So for this would be helpful for agencies that like to utilize the paper copies for sure. And so for that, the QP must sign the NCTOPPS form so that it can be placed in the chart or just in a place of record to show that, you know, the QP that actually did the interview versus just the data entry user that, because it'll show that the data entry user that submitted the interview. So a data entry user has the ability to enter interviews for other QPs, as I've stated. And if a DEU is entering an interview online for a QP, a signature is required because of the fact that it's a printed version. And we want to make sure that the QP responsible for the consumer is noted on there and that is signed off by them. Yes, so, and it needs to be placed somewhere as a record. So the NCTOPPS implementation guidelines. When the consumer's provider agency changes, the QP at the new provider agency must notify the LME/MCO and request for the consumer to be transferred to the provider agency. In order for the transfer to be completed, the QP must submit an authorization to release information for coordination of care form to the LME/MCO. So this is important because of HIPAA. We are required to receive some type of consent stating that it's okay for us to transfer the previous interviews done by the previous provider agency to the new provider agency. So when that transfer is complete, all of the previous interviews that we transfer, now that new QP at the new provider agency will be able to have access to that interview data. And so we as an LME MCO that would be the ones transferring that data over, we need a form filled out stating that it's okay for us to go ahead and transfer those interviews to the new provider agency, and that given that permission by the client or the consumer and the consumer's guardian. So this is what the form looks like for partners. A lot of times if you have a form that is very similar to, and it contains all the data that we, or the information that we need on, that we have on this form, a lot of times we can still receive those forms as well, but this is our standardized form. It gives all of the consumers information, the QP's information, and the location and agency that it needs to be transferred to, as well as the time period that would be transferred to the new agency. And it does require a signature. So it's pretty much just for NCTOPPS history. So an initial interview must be completed with the consumer in person, or with an in-person. And with them being in person. The initial interview is completed within the first or second treatment visit, as part of the development of the consumer's treatment plan. If an initial interview is missed and the consumer is still receiving a required service, an initial interview should be completed as soon as possible. If an initial interview is missed and the consumer is no longer receiving a required service, an initial interview should not be submitted. So if you have a consumer that is in your agency that has not had an initial interview, a lot of times you're still able to, I guess, put the date that you that the consumer actually did start in NCTOPPS, but I think after 90 days, just past that 90 days, you have to do like that day, or like today, that day's date, or something of that sort. And this last bullet goes into the transfers. And one way you'll know that your consumer needs to be transferred is that if this NCTOPPS system does not allow you to complete an initial interview on the consumer. So in that instance, you would contact your LME MCO's Superuser, which would be me. And then I could go in and get the time period that would need to be transferred to you, and you would fill out the form, and then the transfer would occur. But that is the way that you would know. So if you do ever try to put an initial interview in for a consumer and it does not allow you to complete it, or it gives you an error message, 9 times out of 10, it is that the consumer needs to be transferred. So update interviews. If update is not completed on time, it is still required to be completed 2 weeks before the due date to 30 days after the interview is due. So if an update is missed and another update is now due, only the current update can be completed in the NCTOPPS system. For example, if a 3-month update is missed and a 6-month update is now due, only the 6-month update can now be completed. So episode completion interviews. Episode completion interviews must be submitted when a consumer has successfully completed treatment, has been discharged from a program initiative, if they've refused treatment, if they have not received any services within 60 days, if they've changed to a service not required for NCTOPPS, if they moved out of the area or changed to a different LME MCO, if they've been incarcerated or institutionalized, or if they've died, or some other form where they're not able to receive services anymore. If a consumer returns after episode completion interview has been completed, The assigned QP from the provider agency should complete an initial interview for the new episode of care. So if a consumer changes health plans or no longer receives services through the LMEMCO, an episode completion should be submitted. Submitting an episode completion interview for NCTOPPS should coincide with completing a discharge record for the CDW, unless the consumer has moved into services for which NCTOPPS is not required. If a consumer is continuing in services not required for NCTOPPS, the discharge record for this CDW is not required. So the whole reason for the transfers and all of that is to continue the episode of care. So the episode of care is a period that begins with the initiation of services and the ends with the termination of services, or with a lapse in the services of 60 days or more. A consumer who returns to services after a lapse begins a new episode of care. So the whole point of the transfers and all of that is to continue that episode of care. So really, we want the episode of care to begin when they start receiving services that require an NCTOPPS, and then they end when the consumer is done with receiving services that require an NCTOPPS. It's not from provider to provider, is throughout the whole treatment, so that we are able to see the whole picture of their treatment and not just at one particular agency. But it is a good, NCTOPPS is a good tool to utilize to look at different data in regards to the treatment that your consumers are receiving, and the quality of it all. And I'll discuss that more in the report when I discuss the reports. For consumers receiving mental health or substance use disorder services, an initial interview must be completed at the beginning of an episode of care, followed by updates and an episode completion interview at the end of the episode of care. So all NCTOPPS interviews must be entered into the web-based system by either the QP or the data entry user. So, which provider agency completes the NCTOPPS interview? When a consumer has one or more qualifying services, the responsibility of the NCTOPPS interviews is determined by a hierarchy of services based on age, disability. Priority is in a hierarchical order. And so that if a consumer is receiving 2 or more of the required services during a given period, the service that is in the highest order on the table is responsible. So I'm going to go ahead and go to the table. So pretty much this table is what you would use to determine if you or another provider should be completing the NCTOPPS if this consumer is receiving one or more services that require an NCTOPPS. So as you can see at the top here, we have residential services, and towards the bottom here, we have supportive employment, and transition management services and things like that. So, excuse me. As you can see, so for example, if a consumer is receiving supportive employment services as well as residential services, then the residential services provider would be the one that would complete the NCTOPPS interview. So it is based on whoever is providing the higher service. So service codes requiring NCTOPPS. NCTOPPS interviews are required for 100% of consumers ages 6 and above who have been formally admitted into an LME-MCO by having an open record with a unique LME-MCO consumer record number. And that's important. You would need the consumer record number or alpha number as well to submit an initial interview for your consumer. And it's important to use that number. I know in many instances we have seen that a lot of the provider numbers have been utilized as a consumer record numbers. So it's very important to make sure that you and your staff or and all of the QPs are utilizing their alpha numbers as their consumer record number and not any other numbers. That allows us to be able to go in and utilize that consumer record number to create reports and things like that as well, such as our provider scorecards that we send out quarterly that reflects the initial interview timely submission. That really helps us with being able to see who has been submitted in NCTOPPS and those types of things. So it's important that that consumer record number is the alpha number, the assigned number that your LME-MCO has provided. All right. So if a consumer changes health plans and no longer receives services through an LME-MCO, NCTOPPS is no longer required. All child and adolescent consumers under the supervision of the juvenile justice system who are receiving any mental health or substance use disorder treatment services are required to be in NCTOPPS if an LME-MCO enrolls them into the consumer data warehouse. So here is a screenshot of the service codes that require an NCTOPPS. And this can actually be found in the implementation guidelines that's found on the NCTOPPS main website. All right. So NCTOPPS interviews are required for all adults and children ages 6 and above who are receiving any qualifying service for any mental health or substance use disorder issues. NCTOPPS interviews are not required for consumers receiving only one or more of the following services. Okay, NCTOPPS are not required for consumers receive, oh, I'm sorry, I did just say that. So some of those services are unmanaged outpatient therapy and or medication management, crisis services, psychiatric inpatient, hospitalization services, developmental disability services, and supports. Consumers who receive IDD services and supports, as well as MH or SUD services require an NCTOPPS only when the services are predominantly treating MH or SUD services. The LME-MCO will determine whether the NCTOPPS is appropriate for each MH-DD or SUD-DD consumer. Consumers and the adult with developmental disabilities target population, or consumers and the children with developmental disability target population are not required to have NCTOPPS interviews. So if you're in a place where you have no internet or you're working off site, I mentioned earlier that there is an option for the interviews to be printed. And so these printed versions of the interviews can be found on the NCTOPPS main website. And here is a screenshot of what that main website kind of looks like. And this first link is where I was mentioning the at a glance dashboard, and that's what that looks like. And then as you can see at the bottom, you see the NCTOPPS 2.1 website link. That is going to be your main website link that you'll go to submit the NCTOPPS interviews and things like that. But this middle one here, locate what you need to get started using NCTOPPS. And this will be where you will find the printable forms as well as the implementation guidelines and things of that sort. So as you can see here at the top, you'll find like the guidelines and other helpful tools to utilize and when getting started with NCTOPPS and getting yourself familiar with it. But here at the bottom is where you can find the printable interview forms for adult, adolescent, and child consumer age groups. And so here you go. That'll give you just an idea of what that screen looks like. All right, so LME, MCOs, and provider use. So LME, MCOs, and provider agencies use NCTOPPS for outcomes tracking, quality management, and quality improvement initiatives, accreditation, and person-centered treatment planning. So some of the resources that you can utilize to aid in those particular things are the NCTOPPS individual report, where it gives you the initial interview and then the two most recent updates for your consumers. Those can be utilized to help with quality management and quality improvement initiatives and things of that sort. Recovery follow-up interview, which is completely optional, and that's why I don't really include it in a lot, but I do like to mention it as well, because they can also be used to help with for accreditation purposes and things like that, just kind of tracking that post-treatment and where the consumer is and getting those outcomes post-treatment. And then the NCTOPPS at a glance 2.0. And so that's also found on the NCTOPPS main page where I showed those links for the actual main website as the NCTOPPS website, as well as where you find the printed version. So some other tools, but this requires a Superuser login, is the simple query report and the advanced query report. So consumer use. So the NCTOPPS at a glance dashboard is actually accessible to anyone. So this is a great tool that consumers could use to kind of look and see some of that interview data and see how it's used by the state to and how we look as a state in regards to those different indicators that are pulled from the interview. It allows them to look at it from the state perspective as well as from an LME MCO perspective. So when you go in, you can compare the state overall compared to individual LME MCOs and things of that sort as well. So but they can also track the progress of their treatment by using that individual report as well. So it's really cool and really great for you all to discuss those individual reports with your consumer. And so NCTOPPS makes it very easy to pull that report and to even print it out so that you can utilize it during those visits. NCTOPPS also provides an option for you to pull out the aggregated data that comes from the interviews. And some of us may call it the raw data. And you can utilize that to also look at outcomes and create reports and things like that that could be utilized for various different options or resources such as grants and things like that. It's always great to have another source of data that would allow you to be able to kind of brag on how well you're doing, and how well your consumers are being treated. Some of the projects that we have here at NC for NCTOPPS here at Partners is the increased initial in NCTOPPS interviews. And our goal for that is to be at 80%, that 80% of the initial interviews are completed on time. And so I mentioned that earlier in regards to the consumer record numbers. A lot of times we'll see that, some providers not getting the full credit for the initial interviews being completed on time because the numbers don't match. And a lot of times what we'll do, we run a report that pulls the we pull a report in NCTOPPS of all of the we pull a report in Alpha that pulls all the members that require an NCTOPPS initial based on claims, and then we'll crosswalk it with what's in NCTOPPS. So one of the numbers that is crosswalked is that unique Alpha number, consumer record number that we assign. And that's how we utilize those numbers when we're looking them up in NCTOPPS. So it's super important to make sure that those consumer record numbers, as well as the CNDS numbers, are correct when you're submitting them in NCTOPPS. And that will allow you all to get the credit for the initials that are submitted on time. And so also Partners is still monitoring the in-person and telephonic combined interview method, meaning that the interviews are either completed in person or over the telephone. And that goal is 65%. And we're still looking at that, as well as increase the percentage of consumers completing an episode of treatment, completing an episode of treatment or episode of care. And the goal for that is 25%, because we understand that there's a lot of different factors that can be looked at in regards to the reasons for episode completion being done. And I listed all of those. And so it's not always a bad thing that they're, not completing treatment, but it is something that we do want to see as a reason more than the others. So the interview method report, that one is, it kind of goes and it coincides with the previous QIP or PIP or PIP that we used to have that tracked whether or not the consumer's interview was completed either in person or over the telephone or by record. And this one's kind of back in the day, but many of the times we'll see that the record and notes would be utilized to gather the information. But what we really want to see is the in-person and telephone interviews. And so this report will break it down by these questions here and just kind of give you these graphs as like results to show you what the percentages are for those and how those episode completion interviews are completed. So the reason why in-person and telephone methods are beneficial is because it provides valuable information. Like I said earlier, at a certain point for those interviews, if the consumer isn't there either in person or over the telephone to give the answers, there you have to stop at a certain question in the interview. And here is a list of all of the information that gets missed if it's not done with the actual consumer right there. to talk about their treatment experience and where they are now. So it's super important to make sure that those are done either in person or over the telephone or video conference if need be. But all of these are definitely wonderful reasons for why we want to have it done that way, so that we can get the information that we need to kind of get a whole person view of where they are now in their treatment, seeing the improvements and things of that sort. And I think one of the biggest ones that we use is the helpfulness of program to improve quality of life, symptoms, hope, control over life, educational status, housing, and employment. I think that's the one that we utilize the most. But it's super important to know that their emotional well-being is being improved and things of that sort. And the only way we'll know that is by asking. And so looking at records and notes can't give us those answers. So that is the reason why we stress the in-person or over the telephone or video conference. I mentioned earlier as well as about the outcomes at a glance 2.0 report or dashboard. And as I stated earlier, it allows you to view, and this is public, you don't have to have an actual login or anything like that, and it allows you to look at the state compared to the LME MCOs and vice versa. And so it's a pretty useful report to have, and so you can definitely use it, and it puts it in neat graphs for you as well. And all you have to do is click the indicators that you want to see. This is the end of the intro to NCTOPPS portion. As you can see here, the NCTOPPS help desk information is here. The NCTOPPS at ncsu.edu is the email address for the help desk, and the help desk pretty much handles all of the back behind the scenes things. For myself, being the super user here at Partners, I handle all of the transfers and any questions in regards to whether or not an interview needs to be submitted, or those types of things that are dealing with like consumer information and specifics on that end. But they handle a lot of the behind the scenes if you need it, if you're having an issue with the system or username, password type things. But I'm also reached at nctoppsquestions@partnersbhm.org. That is our NCTOPPS questions email address for partners. And we do ask that there's no identifying information that is sent. But that is the end of the NCTOPPS introduction portion of the training. I will get started and move right on into the super user training portion right now, but I'll give it a few seconds just in case anybody did not plan to or want to learn about the super user portion of the training. So I'll give everybody a second. All right, so we'll get started with the NCTOPPS super user portion of the training. As I stated, actually, I'm sorry. I probably should have asked if there was any questions. Does anyone have any questions in regards to the NCTOPPS introduction portion of the training?
Looks like we're good.
All right. Okay. Well, I will go ahead and move right on into the super user portion. All right. So as I stated earlier, super users are required. Every agency should have a super user because these individuals are the ones that have the oversight responsibility for the provider agency or the LMEMCO. They are the ones that are able to, well, go ahead and move into this one. They are the ones that are able to track the submissions and the due dates and change a consumer's QP and manage their user enrollment requests. So they are the ones that are able to approve or deny those user requests. And it's super helpful to utilize your super user to do that versus even myself, because a lot of times, the super user is there. They know who needs access, and those types of things. A lot of times I'll have to reach out to an agency to ask if this particular person is supposed to have access. And or if a lot of times if the email address is the domain part of the email address is the same, then that's a good clear indicator. But some agencies, you may utilize Gmail or different platforms, and sometimes I don't know who is supposed to be, and so a lot of times I have to reach out to the actual agencies. And so that is why having an actual super user on for your location is super important, so that they're able to manage those enrollment requests. So how do you become a super user? If you are already an approved NCTOPPS user for your agency, you just need to contact the NCTOPPS help desk to request a super user enrollment form. And I actually, you can also reach out to myself through the NCTOPPS questions at partnersbhm.org email address as well to obtain that super user enrollment form. But it would still need to be sent to the NCTOPPS help desk in order for them to make those changes within the system to change you from being just, just a QP to being a super user as well. And so that it'll allow you to have access to those features of accepting enrollment requests and being able to change consumers' QPs and access to the various reports that requiring a super user login. So after the form is filled out, you can scan it, or really you can just send it in now. I don't believe it requires a signature or anything now, so you can just type in your information and email it to nctopps@ncsu.edu. So new users for any agency need to enroll in the web-based system as a QP and be approved before they can become a super user. So it's important to make sure that you're already in the system prior to submitting that super user enrollment form. So here are some of the super user tools that you will have access to when you become a super user, or if you're already a super user. After you click your location that you need to go to, that super user tools tab will appear in addition to your website submission and reports tabs. And some of those tools are user search, code book, manage user requests, remove users, and change consumer QP. So when you get an email to approve a new user, you'll log in with your current NCTOPPS username and password. You'll click on the locations tab to select the LMEMCO and provider location in the blue bar near the top of the page. Once you choose the appropriate location, the super user tools tab will appear next to the locations tab, as I've shown. Click on the super user tools tab and click on manage user request. You will see the names of prospective users in your user management request queue. If your queue is empty, there are no users that are waiting to be approved. But if it's not empty, you will need to select approve or reject on the far right end of the row next to the user. So I'll go ahead and go to the screenshot so you can see. So as you can see, there's this would look like it once they're populated with users that need to be managed. And so as you can see, there's a approve and then there's a reject button next to on each row. And so pretty much when you click approve, it'll drop down to this approval box. And when you click reject for certain ones, it'll go down to the items for rejection. And then you would click confirm and it saves it. And there you go. So once you save it, then the best way for you to see those users again, they'll move to your removed users. And so when removing users, and it's not necessarily that these are users that you need to remove, but if you needed to remove a user, this is where your list is. And so as the agency super user, you should always remove users when staff leave your agency. Click on the super user tools tab and click on remove users, and you will see a list of active users at the provider agency you have selected. Find the row with the username you wish to remove, and at the far right end of the row, click on the remove button and then click save changes. So here's a screenshot of that actual screen. As you can see, the remove users option is under the super user tools. And this is what that screen looks like, and it'll show you the status, and right beside the status for that particular user, you'll see the button where it says remove, and you click on all the ones that you want to remove, and then you click save changes, and it has completely taken them out. Super easy, but the problem is that if you mistakenly click remove, you want to make sure that before you click save changes that you have click the button for all the ones that you want to remove and none that you don't want to remove. The other feature is changing a consumer from one QP to another. You'll click on change consumers QP, and under the episodes of care listing, you'll check the box next to the consumer you want to modify. And at the bottom of the screen, you'll select the new qualified professional you would like the selected consumer to be changed to. And then you'll click modify episode to save the changes. So here's a screenshot of that. As you can see, that change consumers QP page is found also under the super users tool. And as you can see, it shows a list of all of the episodes of care that are listed under that particular agency. And so the super user has the ability to click on the checkbox next to the consumer that may need to be modified or changed to a different location, or a different QP. And so as you see at the bottom, when you click on, you make sure that your provider location is correct. And then you'll see the new qualified professional, and then you would click on the drop down and it'll give you a list of all of the QPs that the consumer can be changed to. And once you have made all of the changes that need to be made for that need to be moved to that particular QP, you will click modify episode to save the changes. So if you have an incomplete interview, you'll want to utilize the manage episodes of care to selection, and you will find the interview that was started under the episodes of care box. And I'll actually go ahead and go to the screenshot. So this manage episodes of care is found under the web submission tab. And so once you click on manage episodes of care, it'll bring you to this particular page where you can go under start interview for an episode listed below, and you'll see a drop down box that will allow you to select incomplete interviews. And it'll also allow you to even give the date span that you want to look, that you're looking for. But once you get those, you'll click get those episodes, and they will populate in the episodes of care box. And so from there, you will find the interview that needs to be completed or that is incomplete, and then it will populate down here at the bottom. And so then once you have that it populates in that list of interviews for selected consumer, you'll click the resume button to finish and submit, or delete it if it needed to be deleted. So that's how you'll handle any incomplete interviews. But this is something that a super user is able to do and not just a QP. And you've heard me also talk about the updates needed report. So this is something that a super user has access to as well. It is located under the reports tab. The updates needed report, when you click on it, it just gives you all of the update interviews that are coming that will be due soon. And so this allows you to either export it or print it out. And this could be used to help with planning to make sure that those updates are completed on time. So we really lean on the super users to help with managing and making sure that the QPs are getting those updates done by their due date. So super user information that is specific to partners. Partners has been monitoring the updates needed for our provider agencies for a while now. We utilize outcomes data from the Simple Query report mainly, and then we also utilize data from the interview report as well, interview search report, and we utilize those for what we create we use those to create our provider scorecards that we send out quarterly. The interview search report is utilized to find the initial interviews that come up in our report based on our claims data. And we use the Simple Query report to look at our interview method and just kind of continue to monitor that data, as well as some of the other identified information that I spoke about earlier, and for the reasons why we need it to be submitted either in person or over the telephone. Provider agencies demonstrating significant issues with NCTOPPS compliance will be contacted via phone or email. If the problems continue, a plan of correction or other sanctions will be required. Assistance, if needed, is available through the contacts at the end of the presentation. So yeah, if your agency is needing assistance or to the NCTOPPS questions at partnersbhm.org email address, which I'll provide also at the end of the presentation, because we're all in this together, and we definitely want to make sure that we do our part in helping with it however we can, with making sure that you have everything that you need to be successful in getting the initial interviews submitted, as well as getting those update interviews submitted on time, and that we're receiving all of the information that we need from our consumers. So NCTOPPS outcome system collects national measures developed by SANSA and Washington Circle Public Sector Work Group, functioning, mental health symptoms, suicidal thoughts, substance use, etc. Life domains, school, work, life arrangements, school, social and familiar, relationships, arrest and criminal justice involvement, access to services and helpfulness of services, and North Carolina seen as early adopter in leader in mental illness outcomes. So inside the simple query report, so one of the reports that I've talked about that super users have the privilege of having is a simple query report. And pretty much a simple query report summarizes key indicators from, or key data that comes from the interviews. And so you'll be able to see it for your agency, you know, what those particular percentages are, such as, like I talked about the interview data collection method. It'll give you a automatic graph of all of the interviews that have been submitted and whether or not they were in person, over the telephone, or done by notes. And so this allows you to kind of get an idea where your agency stands in regards to different things required from the interviews. And it doesn't require you to do anything but run the report. So it's super easy. And it gives you a lot of great information that is very helpful in looking at the outcomes of the treatment and the voice of the consumers that you're treating and providing services to. And this is just a few barriers to treatment, services deemed important at initial versus received at episode completion. So it's really, really neat information to that you have access to, and it's free, and you know, it's coming from interviews that are required to be submitted. So it's like, why not use the information? One of the newer reports is the advanced query report. This one's a little bit more, it dives a little bit more down in the weeds of things, but it's definitely another good report to utilize as well. Here's some screenshots of that. And this is what it looks like in the final form of it. All right. Well, thank you all so much for joining me this morning for NCTOPPS introduction and super user training. Here are the contact information that you may utilize. Again, the NCTOPPS help desk as nctops@ncsu.edu, and the partners NCTOPPS questions email address is nctoppsquestions@partnersbhm.org. Thank you. It looks like I do have a raised hand, so I will you can go ahead and ask your question.
Hi, good morning.
Hi,
So since I've been here, I've always heard that as a QP, we have so much time to get the NCTOPPS done for one of our clients. So my question is there a time limit that we need to have this turned in to have the NCTOPPS completed when a new client comes in?
It's within that first or second treatment visit. So pretty much
So
what
48.
I'm sorry.
So I'm thinking like 48 hours.
Yeah, it's really based on the claims. So within that first or second submitted claim.
Yeah, in our case, we're residential. I guess that's why I'm thinking. Yeah.
So yes, 48 hours.
Okay, thank you. I'm sorry.
You're fine. That makes perfect sense. So yes,
Okay.
48 hours.
All right, thank you. I just
You're
needed
welcome.
clarification on that.
Oh, no problem.
Okay.
Does anyone else have any questions?
I actually do. So since I've been working, well, I'm a licensed clinical mental health counselor, but and so I still do some of the NCTOPPS as well. But so we've always been taught that when a client leaves, we just do a discharge. So were you saying back on the other part of the meeting that there's another form that we're supposed to fill out to give authorization, I guess, for the next, if there be one, the next LMO or LME MCO to have access to those?
So it all depends on what's their reasoning for leaving. If they're going to another agency that requires an NCTOPPS service, then that new agency would need to do a transfer form. Y'all wouldn't have to do that. The new agency would need to submit that transfer form for us to transfer the consumer over to them in NCTOPPS. But if they're not going to an agency or a service that requires NCTOPPS, then you're free to go ahead and do that episode completion.
Okay, makes sense. Thank you.
You're welcome. Does anyone else have any questions? All right, well, if there's no more questions, or if you think of any after we end today, you can always send them to nctoppsquestions@partnersvhm.org. I thank you all for joining me this morning and attending our training. So I hope you all have a great day. Thank you.
Thank you.
Thank you.